Hi, my name is Khalil Sharara, and today my group and I will be discussing the correlation of abuse and IQ. Ali will be discussing the topic from a scientific perspective. I'll be discussing it from an educational perspective. Adam will be discussing it from an economic perspective. Noel will be discussing it from a social perspective. And Zaino will be discussing from an ethical perspective. In a study done by Dan Hurley, an American health and medical journalist and author, in the study, Can You Make Yourself Smarter? Hurley discusses how one's training attention and memory can affect their cognitive skills, and it can further affect your IQ. Well, in a study done by Dean Keith Simonton, PhD in social psychology, in a study from Science of Genius, he discusses how IQ and genius are affected by one's environment, and it affects how their brain processes. Discussion of abuse and IQ sparked debate over whether or not the two are correlated directly, which led to the question, to what extent does mental abuse impact an individual's IQ?
In consideration to all of our perspectives, Eve G. Spratt, Doctor of Medicine, claims that higher IQs could be predicted by an absence of externalizing behavior problems. The externalizing behavior problem that we focused on was mental abuse. Mental abuse effects on an individual's IQ can be alleviated through therapy, counseling, and other forms of aid that will be further discussed in our PowerPoint. Individual, as you can see, an example of an externalizing behavior problem is marijuana, and they're showing the correlation between marijuana and its effects on an individual's IQ. As you can see in this section down here, heavy marijuana use by teens is linked to lower grades and exam scores, and individuals that are less likely to enroll in college, which shows how externalizing behavior problem factors can affect an individual's IQ.
So our team's implications are like the effect of not receiving the treatments that Ali stated. So without therapy or using like the hotlines, outcomes include depression, anxiety, substance abuse, things like that. And Suzanne Babel, who has a PhD in somatic psychology, assured that even though parents sometimes don't trust the therapist or trust like using hotlines, without getting at least some treatment, it can cause these factors to be applied to their lifetime.
Limitations include therapy not always working. So in a case done by Jacqueline S. Feather, a PhD, a clinical psychologist, a child with a traumatic past had a hard time coping with things, and they realized that as she kept coping, her coping decreased as well. And she also encourages a positive therapist, a therapy environment. However, some kids can't afford it or they don't have the means to see one at a time.
Due to the limitations surrounding therapy, a study by Susan K. Teljohan described that a way to counter this would be to set up programs in schools that teach children how to assess situations involving abuse and properly report it. While this would teach children how to react in situations involving abuse, it would not teach children how to cope with it and receive the therapy necessary, and it would also allow parents to manipulate children to prevent them from reporting it.
In a scientific perspective to our argument, Dr. Michelle Busquet and Lowe claims that childhood trauma can affect multiple measures of cognitive functioning in youth. She's discussing the aspect of physical abuse within IQ levels of individuals. She claims that physical abuse can lead to trauma, and trauma within individuals leads to learning disabilities within individuals, which lowers their IQ level. Martin A. Tischer, who's a doctor of medicine, also claims that verbal abuse can negatively affect the way the brain adapts. Throughout her article, she states that the brain is highly adaptable and that negative word usage can affect the brain in a negative way, decreasing the cognitive functioning within a person, decreasing their IQ levels. In this picture, it represents the claims that Tischer has made. It's a correlation between the number of times a child has been spanked to their change in cognitive ability score. So as you can see, from a child ages 2 to 9, when they have never been spanked, their cognitive ability scores are relatively much higher than they have when they have been spanked 3 or more times and they're extremely low. The argument that revolves around the scientific perspective is that some people, such as Stephen Stonesi, who has a PhD, believe that abuse experienced by individuals cause them to push themselves towards driving higher IQ. Although this may seem true rarely, other individuals such as Joseph M. Bowden, who's an experimental social psychologist, claims that psychological abuse diminishes an individual's ability to enhance their intelligence. Because physical abuse causes individuals to acquire trauma, and trauma leads to learning deficiencies which can further decrease their intelligence, this is why the statement that Stephen Stonestein made is not valid. A possible solution to the scientific perspective regarding mental abuse and IQ is therapy. Good Therapy, which is an online directory that directs people towards therapists, is used to help people discuss their issues that they're having with mental abuse, which can help them alleviate some of the effects mental abuse has on the brain. And this diagram pictured from treatment patterns vary among people with co-occurring disorders. It shows the correlation between people receiving treatment for their abuse. For most of the people that are coping with mental abuse are receiving treatment, so it shows that this is a possible solution to helping those cope with mental abuse.
From an educational perspective, it's been found by Lisa Ann Heister, PhD in developmental psychology, that those abused were likely to have lower scores in the literacy tests. And in a study done by Joshua Leshnat, PhD in the study of law, he found that psychological abuse can lead to trauma so severe that one forgets random events. In this visual right here, it shows different forms of mental abuse and how those affected tend to have higher learning disabilities, and from any ages, from 75 to older to any age. And one could argue that the individual chooses to forget the memory because it's been so traumatic, but it's been found that repressed memories stand in the way of the victim and their credibility, as trauma causes them to forget the memory, as conducted by Leshnat. A possible solution from an educational standpoint, as said by Felicia F. Romeo, PhD in social psychology, is to have educators step up and to report abuse to child abuse hotlines to prevent further devastation to the child.
So according to a study done by Nancy Lewis, a staff attorney at the intellectual property practice, people who are at a lower socioeconomic status tend to have lower rates of literacy, which further drives them into the cycle of poverty due to them not having the skills to escape this cycle. Now, as you can see here in a study done by John Ekenrode, PhD in psychology, and his colleagues, those who are in low socioeconomic status are more likely to be abused by their parents due to them not being able to provide for their children. And this is shown in a study done by Andy Belden, PhD in psychiatry, that this abuse often impacts brain development in early childhood. Now, if you can see here in this graph, as you look and you see the higher incomes, you see that there is less of a prevalence of very low IQ levels in this graph. Now, for the economic solution, because people argue that the education system fails, a solution would be to increase educational involvement in the lives of children and set up classes on identifying abuse, which would certainly help. And it would also help to invest in programs that reduce economic stress among impoverished families and seek those kids in those families to receive a higher education.
Their social perspective, there are two main factors, physical and verbal abuse, that can lead into mental abuse. For physical abuse, mental disorders begin to build up, and it causes disorders such as multiple personality disorder, which Catherine Petrilli, who specializes in psychological services, found. And through verbal abuse, sometimes victims aren't aware of the verbal abuse they're receiving because sometimes it comes from a loved one and they feel like it can't happen. And then as they keep receiving the verbal abuse, it becomes a reality. And Paige Bierma found this. And for socially, using therapists can cause less of a risk of becoming depressed or becoming anxious or using drugs or anything. And Samantha Saltz, who is an MD in psychology, found this.
From an ethical standpoint, according to M. Jill Rogers, MD, and Diane R. Fallingstaff, PhD in psychology, mental abuse comes from emotional maltreatment, hostility, and intimidation. However, according to Andrea Matthews, LPC and NCC, mental abuse can be overused because of social media and everybody trying to fit into depression and stuff. Yet a person who is continuously being yelled at and ridiculed is going to feel unworthy Therefore, mental abuse would be considered unethical. Traumatic experiences can impact an individual's IQ as well. According to Edward M. Schwartz, PhD in psychology, IQ tests can vary over time. Traumatic experience growing up can impact an individual's IQ. However, people have taken the stance that you are born with your IQ and nothing can change that, but there isn't enough evidence to prove that right now. In this, you can see how emotional abuse and physical abuse and all of these abuses, emotional abuse, it goes into mental abuse, and it's like the most prevalent abuse right now. And it's the solution to my perspective, which is ethical, would be to practice using different cognitive tests and puzzles. Hurley states that practicing can improve IQ level, and the study was done on people who have traumatic brain injury as well.
Okay, the first question goes to Zaina. In the future, what change would you make to your group norms, and how would you expect that to improve the team presentation?
In the future, I'd like to start on the presentation a little bit earlier. I feel like we could have started earlier instead of procrastinating as much, because it could have been a lot more organized, in my opinion, than it is right now.
Okay. Next question goes to Khalil. Reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
Could you repeat the question again?
Yes. Reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem your group identified?
I believe like Ali's perspective, scientific perspective, like reflected more on the group team solution, because it went into mine and to Noel's, as it like scientific goes into both social and educational, and team solution, it discusses how like behavior problems, which could go into scientific and education and higher IQ, which IQ level has to do with education and science of the brain.
Next question goes to Adam. In what way did you improve your ability to work with a group as a result of this project?
So, between writing my paper and working in a group, I found that a lot of this group work and presentations revolved around compromise and building off of other people. As you can see, with the I was originally going to make my alternate solution the actual team solution, but through the limitations found and the implications that Noel gave, I found that therapy would actually be a better solution due to, my alternate solution having some clear holes in it. And I also learned a lot of background through Khalil's perspective and Ali's on just the sort of extent that abuse can have on IQ.
Okay, the next question goes to Ali. What is an example of a compelling argument from one of your peers' individual reports that you decided to exclude from your team presentation, and why?
Can you repeat the question?
Yes. What is an example of a compelling argument from one of your peers' individual reports that you decided to exclude, and why, from your team presentation, and why?
Okay, so one of the compelling arguments that one of my teammates made that we decided to exclude was Khalil's educational argument regarding how schools should start opening up programs to help students with learning disabilities to acquire higher intelligence. We decided to exclude that because it was too close to one of our other arguments made by Noel, which she talked about how social skills should be enhanced in learning so that students can acquire better IQ and their learning disabilities can decrease.
And the last question goes to Noel. What is a way in which your team's resolution makes you think differently about your own individual research?
Can you repeat the question?
Yes. What is a way in which your team's resolution makes you think differently about your own individual research?
So basically our team solution was how therapy is the best way to basically help with treatment. However, mine actually links into the solution, into our team solution, because I also stated that without receiving without receiving therapy, especially people who specialize in psychology, it builds up to keep on going in the victim's lifetime.